Is it your sense that this is a message to Washington to cool it?
Absolutely, Neil. Finally, somebody has pulled the chain on the train. From a doctor's perspective, too much, too quick. Nothing has been addressed in terms of really taking care of patients, cutting down costs, how we're going to do that, and ultimately providing coverage for everybody.
Because I had a theory on this, Doctor. Obviously Massachusetts is a very big medical state, some of the finest hospitals and universities in the world there in science and technology. And they weren't happy puppies with this. How much do you think they weighed in on this debate?
Well, it's interesting because the message behind tonight's win, is that a lot of the doctors involved in President Obama's policy are from Massachusetts, from the Harvard Medical School.
Right.
And when you look at...
Everyone from Harvard we thought was liberal.
Well, we would think.
Apparently not everyone.
But it's remarkable to see how many advisors have been involved in crafting the policy well before the election. And now you have such an enormous referendum right in their backyard to say that we don't agree with what's happened in our own state. We don't agree with the policymakers who have come from Massachusetts. It's a significant statement.
Okay.
And some of those physicians, in fact, when Massachusetts went under its own reform, negotiated their own deals behind closed doors with Blue Cross Blue Shield of Massachusetts and others that were very different from the deal that others got in terms of their reimbursement fees. So I think that this speaks...
They were ticked.
Yeah.
Liberal or conservative, they were ticked. Do you think now, Doctor, you're here in the studio, you're Barack Obama, you're the Democratic leaders, you're Steny Hoyer, you're Nancy Pelosi, you're looking at all the options to save this thing. One is to rush it through the House and get a yea or nay vote. Very tough. Another is to end the 60 votes necessity and just go for a simple majority. Another is just to find a 60th vote somewhere else. Good luck. Or do you think they should just scrap it?
I think they should start over again. I think we all agree that we need health care reform, but we've got to start over because nobody is going to...
Joe Biden says this is a once-in-a-generation chance. You're not going to get this chance again.
Well, but if we do it wrong, then the long-term consequences for everybody are going to be far greater than just getting it through. And I think that's the biggest mistake we're making because what's evident in either of the bills is that the calculations and the assumptions are so far off that in the end, everybody is going to pay more for less. And rushing it through is not good for anybody. In the last couple of days, there was some evidence in the Washington Post. They talked about how a lot of the data that was supported behind what was actually going to cut costs and some of the amendments in the Senate bill were based on data that was completely non-existent. And there you're all but singing "Ding Dong, the Witch is Dead," right? Yeah, and so I think that we need reform, but we've got to rethink and recalculate all of the numbers and get it right before we rush it through.
All right, Doctor, thank you very much. It's like a skit we got here, but these are very smart guys. Guys, I appreciate it.